50 Shades of Grey.
Hello, I am Dr. Bishas. I am a doctor of this clinic.
Okay,
May I
doctor.
confirm your name and age, please?
Yes, doctor. I am Dakota Johnson,
Okay, and
59 years.
okay. How do you feel now?
Doctor, actually not quite good, doctor. You know that I have been some problems with my feet. I came here, but I don't think that the problem in my feet, that ulcer, I guess, it's not going away, and it's actually spreading, doctor. And you have been giving me uh, some medication through my blood channel as well, but yet I am not feeling very good. So I am a bit concerned, doctor.
I'm extremely sorry for your condition, and I am here to discuss about your test reports and our management plan. So, is it okay with you?
Okay, doctor. I'm very eager to know about it. I'm concerned that is it something serious or not?
Okay, and before I give you your answer, can you please tell me that how far do you know about your condition?
Doctor, actually, I think I had some, I think that's ulcer or something in my right foot, and I got admitted here. And since then, I have been getting some medication. And one of the doctors told me that I might be having some problems with one of the bugs. They told me that it's a common bug that can uh, can occur in many people, but it's not going away in my case. I don't know about that. Why it's not going away?
Okay, and is it okay if I explain these test reports and your condition now?
Yes, doctor. I'm very eager. Please do it, doctor.
And do you have any idea, or did anyone told you that what is your test reports?
Doctor, actually, uh, one of the doctors here, he told me that I have had some condition named MRSA. So I don't know details about it, doctor.
Okay, and I am going to explain it for you. Will it be okay?
Yes, doctor. Please.
Actually, as you have came here with ulcer, and after that, as you also have diabetes.
Yes,
So
doctor.
for this type of patient, we try to find out that what is happening with their ulcer, and also for your ulcer, we sent some test reports from the some secretion of your ulcer, and the test results also came out that your doctor said it actually came with a special bug. It is called methicillin resistant staphylococcus aureus, or commonly we call it MRSA.
Yes, doctor. Okay.
And do you have any idea about it?
No, doctor.
Okay. Actually, this is a common bug, as you have already been informed that we have our skin bugs that is called Staphylococcus aureus. We call it by name. Don't bother by this term. But
Yes.
this organism, this bug is present all over our body. It present on my body, present on you, and also anyone else. It is usually harmless organism, but when it get involves or get any cut on our body, at that time they grow in number, and there they can cause ulcer.
Okay, doctor.
Okay, so this is a common bug, but within this bug there are certain groups, they are not responding to certain types of antibiotic. We call them we call them penicillin, as you, I think you have heard of it, the name of penicillin.
Yes.
Okay, and
Yes, doctor.
when this bug doesn't respond to the some medicine like penicillin, then we call it MRSA, or methicillin resistant staphylococcus aureus.
Okay, doctor.
And
Then what do you do in these type of cases, doctor?
okay, and please don't get worried at this time, because there are certain good antibiotics to treat that, and we have already started that, and we will continuously review you, and if there need any alteration, then we will also go for that.
Well, doctor, am I going to be cured because of this antibiotic?
Yeah, actually, there are also certain possibilities, certain factors that is related to this cure, like its extension of the ulcer, and also your body's condition, that how far your bodies can do with this infection. And I came to know that your diabetes wasn't controlled. Is it right?
Yes, doctor.
Okay. Actually, I am sorry to inform you that uncontrolled diabetes also causes delayed healing of this ulcer. So we are trying to make your diabetes control the up to the optimum mark. And at this time, we are also giving the antibiotics to treat the bug. And we also sent some report to see the extension of the ulcer. Do you get me?
Yes, doctor.
And can I discuss something in advance with you?
Yes, doctor. Please.
And as your ulcer is not so much responding to the treatment, and also the ulcer is big, so there is certain chance of involving the bones under the ulcer.
Okay, doctor.
Sorry to say that. Okay. And
You are saying that it can involve the bones as well.
I'm sorry to say that it can also involve the bone, because it can sometimes goes can go so deep that it can involve the bone also.
Well, doctor, can I just have a minute? Actually, doctor, I'm trying to understand that it can go to the bones. Actually, one of my relatives had some amputation in the bones. He also had some infection. Okay, doctor, is the same thing going to happen with me, doctor?
If, Mrs. Dakota, I am not hiding anything from you, but I am afraid that if it involves the bone, then it is also a possibility that you may also need a amputation. But please don't get worried, because we will continuously review that, and we will confirm, or we will inform you after the test results come. But I am not sure that if you will need amputation or not. But there is possibility. I'm sorry to say that.
Doctor, I'm getting afraid. However, you will try your level best not to do this. Am I right, doctor?
Yes, we always are continuously monitoring you, and also giving the antibiotics and also other treatments that are the most effective treatment. And you are also being reviewed by the expert doctors who are very experienced in this field.
Doctor, I have some questions actually at this moment. I have two children, and one of them is quite a small one. She's 7. I am having this bug infection. There is this ulcer. So can she visit me, or do I have to take some precaution?
Okay, as I have told you that this is a common bug. This is nothing so special, nothing so serious. It is just a common bug, but that is not responding to certain antibiotics. That certain antibiotics cannot kill these bugs. It is just like that. There is nothing so much bad with it. Do you get me?
No. I think you didn't get my question, doctor. I told
Yes,
that I have one child.
yes,
She
and
comes to visit me. So
yeah.
we should be able to visit me as normally, or do I have to take any precaution like covering the place, that ulcer or something
Okay.
like that?
Okay, I'm explaining this to you, and I am sorry that if I have taken long time, but I wanted to also clear those things, so I have cleared those things before. Okay.
Yeah.
And also this bug can be present in some normal people, so they will not do any harm, but there is chance that if it gets any cut or any some other infection area, then it can also involve that area. And for that we will recommend uh, any person, any healthcare person or any of your visitors, they can come to you, they can visit you, but we will recommend you just not to touch the area of that infection area. And if any of your visitors have any cut or any infection, then we will also advise them to cover the area before visiting you, because that already cut area that can get the bugs from you, there is a little chance. Do you get me?
Okay, doctor. Okay, I'm getting you, doctor. I'm
Okay.
very I'm thankful to you now, because I was worried about my child. And another thing, actually, telling that there are some precautions to be taken. Actually, I have a wedding function the day after tomorrow. Can I attend it?
Yes, of course you can attend it, and also for this we will just make some arrangements, like we will cover your wound so that it cannot be kept open. And also you can always make a public gathering that will not make bring any problem, but there's some only one thing that we you will have to follow, that keeping this ulcer area hygiene and clean, and not to be touched by anyone, or uh, not to be given touch by anyone. You cannot, that is means you cannot touch anyone with this ulcer, or anyone cannot touch your ulcer.
Okay, doctor. I get it now.
Okay. And also all time there are certain precautions then that we can also follow. That is, if you are touching the area or anyone can touching around the area, then some precautions like hand washing that can be done. There is no certain type of that is called uh, obligation that they will have to do that, but they can certainly maintain that personal hygiene.
Sorry. Can you please tell me again? I couldn't get it actually. Personal hygiene.
Okay. And as you said about visitor, they can certainly maintain personal hygiene, that is
Okay. Now I get it.
before visiting
Yeah.
you or after visiting.
Yeah.
But it is not
Get
a
it. Thank you.
obligation that you are being treated separately.
Hello.
Yes.
Yes. So, thank you, doctor. I can certainly understand a lot now.
Do you have any question for me?
Doctor, actually, I have some insurance policies. I would like to know that if I have that operation, will it hamper my insurance?
Yeah, actually, I am quite quite sure that what type of insurance and will it affect your operation or any other treatment. And for that, I can contact the respective department, and I think they will be able to give you proper guidance on that, because I am not sure with the insurance policy.
Okay, doctor. Okay.
Do you have any question for me?
Doctor, I don't have too many questions now. I'm quite happy with your answers, actually.
Okay. And is it okay if I ask you a few personal question?
Yes, doctor.
Okay. And may I know that yeah, as your diabetes isn't controlled, is there anything that is um, affecting you? That is, you cannot take medication, or if you cannot take maintain proper lifestyle, is there anything that you can share? Then I think I can help you with that.
Okay, doctor. Actually, I think I have to take too many medications for this. Okay, sometimes I forget some medications, and I think that might be a cause. Like I cannot control it.
Okay, I can understand this happens to a lot of person, and for that I can contact our our hormone doctor or our diabetes doctor and the respective pharmacy, and they will be able to consider your condition, and they will be able to give you some medication that you can take less often, and that can also reduce the number of your medication. Will it be okay for you?
Yes, doctor.
Okay. And is it okay if I ask you a few other personal questions?
Yes, doctor.
And do you smoke cigarette?
No, doctor.
That's very good point. And do you drink alcohol?
No, doctor.
That's another very good. And do you drive?
Doctor, occasionally.
Okay. And actually, we'll also consider this because as your treatment may affect the driving, so we'll consider that.
Okay, doctor.
And if you don't mind, may I know that do you need any social support or any financial support from us? Then we can try for the arrangement.
No, doctor, I don't think so at this moment.
That's fine. So if you have any question, any concern, then you can always contact us. We are always here to help you.
Okay, doctor. Thanks a lot.
Okay. And after the test results come, we will again make an arrangement with you, and we will give you our further management plan. Okay.
Okay, doctor. Thank you.
Okay. Thank you.
So how much was left?
4 minutes.
Hello?
4 minutes, I think.
Hello?
Hello?
4 minutes?
I think.
I don't think so.
3 minutes.
I think it crossed.
Crossed.
I think so. Have you kept the timer this time?
Okay, I think I started at 8:02.
Okay, I'm not quite sure, but I think that it's crossed. However, it's been quite right. How do you think? So, what was your task in this case?
My task was to explain the condition of methicillin-resistant Staphylococcus aureus, and also explain the management plan, including her. There is including the possibility of amputation.
Okay, so how do you think the conversation went?
I think I can meet all her concern, and I have answered all her question without any bias, and also I tried to help her with all the information she needed.
Okay, so I think actually you did really well, and you actually covered almost all the points here. Even you went to her personal life, and smoking, that was very important. Smoking, alcohol, and diabetes control, that was very important. And I think you covered almost all the topics here. So do you yourself want to add anything?
No, that's one thing that I couldn't keep the time. I forgot. I thought that it was at 8. And
I that it was a bit overtime. I'm not quite sure, but I think so, because I had some watch
I
before
will
me.
count it.
Yeah,
I'll count it.
I think that there was 1 minute or 2 minutes more. I am not quite sure, but I had some that watch before me, so I think that it was time. It was 14